The prostate is a small gland that is part of the male reproductive system. It is located below the bladder and in front of the rectum, and it surrounds the urethra, which is the tube that carries urine and semen out of the body. The main function of the prostate is to produce the prostatic fluid for semen, which is a fluid that carries the sperm out during ejaculation. As men get older, the prostate can have some problems. One of the most common ones is what is known as an enlarged prostate or benign prostatic hyperplasia, which simply means the prostate growing larger and squeezing the urethra. This can cause symptoms such as difficulty urinating, frequent urination, weak urine stream, or feeling like you can't empty your bladder completely. An enlarged prostate is not a cancer, and it doesn't increase your risk of cancer, but it can affect your quality of life and increase your risk of urinary tract infections or kidney problems. And it can be treated with medications, surgery, or other procedures. But another big problem that can affect the prostate is prostate cancer. Prostate cancer is the second most common cancer among men in the United States, after skin cancer. It occurs when abnormal cells grow in the prostate and form a tumor. The exact causes of prostate cancer are not known, but there are some factors that may increase your risk, such as being over 65 or having a family history, which means having a father or a brother with prostate cancer. Other factors that can increase your risk are smoking, being overweight, and eating a lot of red meat or high-fat dairy products. Race also can raise your risk, as African American men have a higher risk than other races. Prostate cancer can be slow-growing or aggressive, and it can spread to other parts of the body like the bones or lungs if not detected and treated early. The problem here is that it may not cause any symptoms in its early stages, but still, there are some signs or early symptoms you should not ignore. So in this video, we will explain 9 of these signs. Number 1. Frequent urination. If you find yourself going to the bathroom more often than usual, especially at night, it could be a sign of prostate cancer. This happens because as the tumor grows, it presses on the urethra, which is the tube that carries urine out of the body. When that happens, it makes it hard to empty the bladder completely. Number 2. Trouble urinating. This is one of the most common symptoms of prostate cancer, and it can include many symptoms such as having a slow or weak urinary stream, a flow that stops and starts, having difficulty starting the flow of urine, or feeling like you haven't completely emptied your bladder. This also happens because the prostate gland surrounds the urethra. When the prostate grows larger due to cancer, it can squeeze or block the urethra and cause these problems. It is important to note here that all these urination-related symptoms can be caused by an enlarged prostate. So if you have these symptoms, it doesn't necessarily mean that you have a prostate cancer. Number 3. Blood in urine. The presence of blood in urine is known as hematuria. This can happen because the cancer cells can damage the blood vessels in the prostate or the urinary tract. Sometimes the blood can be visible as red or brown urine, and sometimes it can only be detected by a urine test. If you notice any blood in your urine, don't panic yet, as blood in urine can also be caused by other conditions, such as urinary tract infections, kidney stones, or an enlarged prostate. So don't think that you have cancer just because you have blood in your urine, but don't ignore it either. It's best to see your doctor as soon as possible and get checked out. Number 4. Bone pain. Bone pain can be a sign of advanced prostate cancer that has spread to the bones. Prostate cancer cells can break away from the original tumor and travel through the bloodstream or lymphatic system to form new tumors in other organs or tissues. When this happens, it is called metastatic prostate cancer, and the bone pain here can be caused by cancer cells damaging the bone tissue or causing inflammation. The bones most commonly affected by this are the pelvis, lower back, ribs, and upper thighs. The pain can be dull, deep, or sharp, and it can interfere with your daily activities and sleep. Number 5. Erectile dysfunction. Erectile dysfunction is the inability to get or keep an erection that is firm enough for sexual intercourse. This condition can have many causes, such as stress, anxiety, diabetes, heart disease, or medications, but it can also be a sign of prostate cancer, especially if it occurs suddenly and along with other urinary symptoms. Number 6. Painful ejaculation. Some men with prostate cancer may experience pain or discomfort during or after ejaculation. This is because if the cancer cells grow, they can press on or narrow the urethra, which is the tube that carries urine and semen out of the penis. This can create pressure and friction during ejaculation, resulting in pain and discomfort. Keep in mind here that there are other conditions that can cause a painful ejaculation, like an enlarged prostate or prostatitis, which is a bacterial infection of the prostate. So, it is always better to check with a doctor if you have painful ejaculation. Number 7. Losing weight without trying. Unexplained weight loss is a common sign of many types of cancer, including prostate cancer. This is a symptom that can indicate advanced prostate cancer or other serious conditions, such as diabetes or thyroid problems. The weight loss here can occur because of loss of appetite, nausea, vomiting, or changes in metabolism due to cancer. So, if you notice that you are losing weight without trying, you should see your doctor as soon as possible. Number 8. Swelling or fluid buildup in the legs or feet. This is a symptom that can indicate prostate cancer that has spread to the lymph nodes in the pelvis or abdomen. The lymph nodes are small glands that filter lymph fluid and help fight infections and diseases. When cancer cells grow in the lymph nodes, they can block the flow of lymph fluid and cause it to accumulate in the lower extremities. Number 9. Loss of bladder control. Some men with advanced prostate cancer may lose control over their bladder due to spinal cord compression caused by cancer spread to the bones of the lower back. This can result in leaking urine, which can be very distressing and embarrassing for the patient. So, these were 9 warning signs of prostate cancer you should not ignore. But remember, some people with prostate cancer may not have any symptoms at all, while others may have symptoms that are caused by other conditions. The only way to know for sure if you have prostate cancer is to get tested by your doctor. There are different screening tests that can help diagnose prostate cancer, such as a digital rectal exam or a prostate-specific antigen blood test. A digital rectal exam is when a doctor inserts a finger into your rectum and feels for any lumps or abnormalities in your prostate. But a PSA test, on the other hand, measures the level of a protein produced by your prostate in your blood. A high PSA level may indicate prostate cancer or other conditions such as an enlarged prostate or prostatitis. So you may need further tests such as a biopsy, where the doctor takes a small sample of tissue from your prostate for analysis, or an imaging test such as an ultrasound, MRI, or a CT scan. At the end, prostate cancer can be a scary and overwhelming diagnosis, but it can be treated successfully if detected early and treated appropriately. And many people with prostate cancer live long and healthy lives after treatment. So, if you have some of these signs, don't hesitate to talk with your doctor. Thanks for watching.